Reproductive system concerns. Most tested topics: amenorrhea, primary versus secondary dysmenorrhea, premenstrual syndrome (PMS), premenstrual dysphoric disorder (PMDD), nursing interventions, NSAIDs, and hormonal therapy. Assessment and patient education. 1. Normal menstrual cycle. Know these normal findings. Average cycle, 28 days. Normal range, 26 to 34 days. Month-to-month variation, about plus or minus 2 days. Cycles are commonly irregular. First 2 years after menarche, last 5 years before menopause. Early adolescent cycles are frequently anovulatory and irregular. 2. Amenorrhea. Definition: absence of menstrual flow. Evaluation is recommended when no menarche and no secondary sexual characteristics by 13 years, no menses by 15 years, no menstruation within 5 years after breast development, no menses for 6 months or longer after previously menstruating. Secondary amenorrhea. Causes: most common, pregnancy, other causes, PCOS, thyroid disorders, pituitary disorders, diabetes, stress, severe weight loss, eating disorders, excessive exercise, certain medications, drug abuse, oral contraceptive use, female athlete triad, associated with amenorrhea, eating disorders/low body weight, premature osteoporosis, low bone density. Assessment. First priority: rule out pregnancy with a beta-HCG test. Additional tests may include CBC, urinalysis, serum chemistries, FSH, TSH, prolactin, CT/radiographic evaluation of the sella turcica, progestational challenge, pelvic sonogram. Nursing care. Focus on reversible causes. Stress reduction. Improve nutrition, weight restoration, modify exercise, counseling, relaxation techniques, referral when appropriate. 3. Dysmenorrhea. Definition: pain during or shortly before menstruation. 2 types: primary, secondary. Primary dysmenorrhea. Characteristics: occurs with ovulatory cycles, usually begins 6 to 12 months after menarche. Caused by excessive prostaglandin, PGF2 alpha, release. Pain begins with menstruation. Lasts 12 to 72 hours. Common symptoms: cramping, back pain, nausea, vomiting, diarrhea, headache, dizziness, sweating, weakness. Nursing interventions: non-pharmacologic, heat application, aerobic exercise, relaxation techniques, biofeedback, TENS, pelvic rocking, healthy nutrition, reduce salt and refined sugar before menses, natural diuretics, low-fat vegetarian diet, vitamin E, medications. NSAIDs are first-line therapy. Start several days before menses or at onset of bleeding. Oral contraceptives may reduce symptoms. Levonorgestrel IUDs may decrease dysmenorrhea. Safety: take NSAIDs with food. Monitor for gastrointestinal bleeding, dark stools. Avoid NSAIDs with aspirin allergy. Secondary dysmenorrhea usually begins after 25 years of age. Associated conditions: endometriosis, adenomyosis, pelvic inflammatory disease, endometrial polyps, fibroids, leiomyomas. Characteristics: dull aching pain. Pain may radiate to back or thighs. Pelvic fullness. Heavy menstrual bleeding may occur. Diagnosis may include pelvic examination, ultrasound, endometrial biopsy, laparoscopy. Treatment: treat the underlying pathology. 4. Premenstrual syndrome, PMS. Definition: a group of physical and psychological symptoms occurring during the luteal phase and resolving after menstruation begins. Common symptoms: bloating, breast tenderness, weight gain, edema, depression, irritability, anxiety, crying, food cravings, fatigue, headache, backache. Key points: ovarian function is required. Does not occur before puberty, after menopause, or during pregnancy. Can still occur after hysterectomy if the ovaries remain. 5. Premenstrual dysphoric disorder, PMDD. More severe form of PMS. Diagnosis includes 5 or more symptoms. Symptoms occur during the week before menses. Improve after menstruation begins. Symptoms interfere with work or relationships. confirmed with daily ratings for at least 2 menstrual cycles. Common symptoms: mood swings, irritability, anxiety, depression, feeling overwhelmed, appetite changes, sleep disturbances, difficulty concentrating. Nursing education for PMS/PMDD. Encourage symptom diary, lifestyle changes, regular exercise, whole grains, fruits and vegetables, reduce caffeine, reduce salt, reduce sugar, natural diuretics if appropriate, high-yield drug facts. No. NSAIDs inhibit prostaglandin synthesis. Ibuprofen and naproxen are common first-line choices. Acetaminophen is less effective because it lacks anti-prostaglandin activity. Oral contraceptives improve primary dysmenorrhea in many women. Must memorize. Amenorrhea. Always rule out pregnancy first. Primary dysmenorrhea. Younger women. Ovulatory cycles, prostaglandins, NSAIDs are first-line treatment. Secondary dysmenorrhea, PMS, usually after age 25, caused by pelvic disease. Physical and emotional symptoms before menses, PMDD, severe mood symptoms that interfere with daily life. Amenorrhea, definition, absence of menstruation. Most common cause, pregnancy, other causes, strenuous exercise, stress. Eating disorders, type 1 diabetes, anatomic abnormalities, hysterectomy, not a cause, lack of exercise. Memory tip, amenorrhea. First, rule out pregnancy. Dysmenorrhea, definition, painful menstruation, pain, cramping, sharp or dull, lower abdomen, suprapubic area, may radiate to lower back and thighs. Most common in ages 17 to 24, smokers, women with obesity, drug of choice. NSAIDs, helpful nursing interventions, heating pad, exercise, reduce red meat, increase natural diuretics, rest as needed. Premenstrual syndrome occurs during the luteal phase, ends shortly after menstruation begins. Symptoms: irritability, mood changes, bloating, breast tenderness, headache, fatigue, anxiety. PMDD, more severe form of PMS, cause unknown, lifestyle changes. Exercise, healthy nutrition, stop smoking. Evening primrose oil, reduce caffeine, reduce alcohol. Endometriosis, definition, endometrial tissue grows outside the uterus. Classic symptoms: severe dysmenorrhea, dyspareunia, infertility, chronic pelvic pain. Medication, nafarelin. Side effects: hot flashes, vaginal dryness. NCLEX, clue, painful periods plus infertility equals endometriosis. Menstrual disorders, menorrhagia, heavy menstrual bleeding. Metrorrhagia, bleeding between periods. Oligomenorrhea, infrequent menstruation. DIUB, most often caused by anovulation. Diagnosis after excluding other causes. Estrogen is effective treatment. Uterine fibroids, also called leiomyomas. Characteristics: benign, estrogen sensitive, shrink after menopause. Main symptom: menorrhagia. Remember, benign tumor with heavy bleeding. Sexually transmitted infections. Highest risks: multiple sexual partners, unprotected sex, poor preventative behaviors. Safe behaviors: abstinence, dry kissing, chlamydia, most common bacterial STI. Treatment: doxycycline, azithromycin. Treat sexual partners too. Gonorrhea, drug of choice. Ceftriaxone. HPV, most common viral STI. Important facts: causes genital warts, can lead to cervical cancer. Treated with podophylax. Virus is not eliminated completely. HSV-2. Characteristics: painful lesions, fever, dysuria, recurrent outbreaks. Treatment: acyclovir, HIV. Diagnosis: HIV antibodies, seroconversion. Usually 6 to 8 weeks. Pregnancy: zidovudine reduces fetal transmission. Hepatitis: hepatitis A, contaminated food and water. Hepatitis B, vaccine available, more contagious than HIV. Hepatitis C, no vaccine, incidence increasing. Vaginal infections: candidiasis, thick white discharge. Cottage cheese appearance, severe itching. Fluconazole. Bacterial vaginosis, thin gray discharge. Fishy odor. Trichomoniasis, frothy yellow-green discharge. Gonorrhea, Often no symptoms. Minimal discharge. Pelvic inflammatory disease. Treatment: semi-Fowler position. Bed rest. Broad-spectrum antibiotics. Finish all antibiotics. Avoid frequent pelvic exams during acute infection. Breast cancer. No. Exact cause unknown. 1 in 8 women develops breast cancer. Diagnosis: fine needle aspiration confirms diagnosis. Mammogram is screening. Risk factors: family history, race, nulliparity, first pregnancy after age 30, early menarche, late menopause. Tamoxifen, common side effects: hot flashes, nausea, vomiting, vaginal bleeding, menstrual irregularities, benign breast disorders, fibroadenoma, single movable lump, common in teenagers, shrinks with age, fibrocystic changes, painful lumpy breasts, worse before menstruation. Heat and NSAIDs help. Ductal ectasia, perimenopause, nipple discharge, enlarged axillary nodes, intraductal papilloma, non-palpable benign lesion, mastectomy care. Do: elevate affected arm. No BP on affected arm. No IV on affected arm. No venipuncture on affected arm. Report redness or infection. Empty drains. Avoid tight clothing, heavy lifting, reaching overhead until approved. High-yield NCLEX memorization list. Amenorrhea. First, think pregnancy. Dysmenorrhea. NSAIDs are first line. Heating pad relieves menstrual cramps. Endometriosis causes infertility and dyspareunia. Menorrhagia equals heavy bleeding. Metrorrhagia equals bleeding between periods. Fibroids are benign and cause menorrhagia. Chlamydia is the most common bacterial STI. HPV is the most common viral STI. HSV causes recurrent painful outbreaks. HIV screening detects antibodies. Zidovudine reduces maternal to fetal HIV transmission. BV equals fishy odor and thin gray discharge. Candida equals cottage cheese discharge with itching. Gonorrhea is treated with ceftriaxone. Breast cancer diagnosis is confirmed by fine needle aspiration. Tamoxifen causes hot flashes and vaginal bleeding. Never use the mastectomy arm for BP, IV, or blood draws. Fibroadenoma is common in teenagers. Family history and nulliparity increase breast cancer risk.